What we have learned, actually, is that folks who get good information about concussion at the time of their injury typically have a faster recovery. There's a lot of confusion about concussion, a lot of misunderstanding about concussion and how people recover. So seeking out good care, getting answers to your questions early, is actually a good way to help speed up the recovery. The first thing I would say to anybody who's seeking care from a healthcare provider is that the only bad question is the one you don't ask. If you have a question, you ask it. Concussion, when you read about it or hear about it in the media, it's confusing. So I expect my patients and their loved ones to come in with questions because they don't understand, or it's hard for them to really sort of, get all this information and really have a good understanding of what's happening. So any question that you have, you should ask. That's number one. I think it's reasonable to ask what to expect, what's the typical course of recovery. But then it's also important to realize that, not every concussion is going to follow a prescribed path towards recovery. There could be different factors that may speed up or slow down recovery. A lot of questions are generally geared towards, well, what should someone do after a concussion? In the old days, it used to be rest, 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 rest. Now we're really getting away from that and beginning to think that, well, actually, prolonged periods of rest, or what some people actually refer to as cocoon therapy, where you just put somebody into a dark room and turn the lights off and there's no stimulation, we're actually thinking that actually prolongs symptoms. We're recognizing now that some physical activity below a threshold that worsens your symptoms, some cognitive or thinking activities, again below a threshold that exacerbates your symptoms, may actually speed up recovery. We have a saying, if you've seen one concussion, you've seen one concussion. So everyone's recovery pattern is going to be a little bit different. So it is okay to see your physician, particularly if you're getting treatment, so that we can see how those treatments are coming along and alter them if necessary.